Take a team of clinical experts from their places of work, put them into care homes to carry out patient reviews, and what you get is a higher level of patient care, a reduction in costs and hospital admissions.
Over the first year of operation, we saved £40,000 worth in medication alone. We can say that was due to us. That's £40,000 over the year.
And that's because they went straight to the patients in the homes and not the other way round.
For a lot of the residents here, to take them out of this home environment and transport them to somewhere else is traumatic for a lot of them. So for the team to come in here and actually do the same exercise is very beneficial.
The Smethwick and Oldbury Commissioning Alliance, a practice-based consortium, sought the expertise of a consultant geriatrician, a pharmacist and a nurse to carry out checks of all aspects of some of the care homes in the area.
It was acknowledged early on by all general practitioners that nursing homes were an issue, that we had this problem with patients not being necessarily as proactively managed as we might have done. In particular, we identified that we would look at the medical speciality, in other words, his role as an experienced geriatrician, but also pharmacy and the nursing homes, that we could actually capture all three aspects that were required to get good care in nursing home: medical, pharmaceutical and nursing.
What the team have picked up on, be minor things really, we have sort of acted upon, and it's made us perhaps look at the resident more holistically, whereas we may have, missed off a care plan. They've actually pointed it out to us.
Wandering at night, won't sleep in the bed, sleeps in the chair.
Probably not best giving him sedatives at tea time then.
Okay.
I think practice-based commissioning has made this possible. It's a fairly small project. SOCA only has about 300 residents in nursing homes across the area, which is a fairly small number. So the fact that it was just the few practices who were commissioning it made it easy to set up. I think we had it set up within 3 or 4 months of the initial proposal. By the time we got all the staff together, agreed the proposal, got the nursing homes on board and started. They've left the creams in the room. That's fine. It's the right person. It's the right dispensing date, and they've done an opening date on it.
And it was listed on the care plan.
And we believe, although it's early days to say this yet, that because of being proactive, we are now actually going to see a reduction in admissions from those homes. We're particularly keen to see a reduction in people being admitted.
The nursing home we're in at the moment, it's the second year we've been here, and the level of care, the level of care planning has gone up, and the things that we suggested last year have been taken on board and are still in operation, which is really, really good to see. And we'll just check out the ensuite, make sure that's fine.
Perhaps the disadvantages are it's another layer. There's a bit of extra work to do, inevitably, but I think that's minimal. And I think there have been occasions when the nursing homes have instinctively reacted as though they're being inspected rather than being supported. So managing that pathway has been perhaps a little more difficult than we expected initially. We have had interest from other PCTs. We've had other clusters, inquiring about what we've done and how we're doing it and what we're achieving from it. And from our own point of view, we've had the other clusters in the PCT wanting to take this project forward, and also we internally are wanting now to move this into residential homes as well as our nursing homes.
There are one or two changes we've made with the tablets. We notice it gets confused in the evening, so we're going to retime the antipsychotics and also possibly decrease the dose a little bit because he's not had too much in the way of behavioural problems.
We think that this is very innovative to get the different specialities and everybody coordinating together to actually make a difference in a very high user group. And we think it's probably worth remembering amongst all of this that the patients are getting a benefit too, and actually as we manage these patients in their later stages of their lives more effectively, we get a calmer, more dignified end of life and general care for these patients also.